hierarchy, a recording for evidence-based dentistry project. We're discussing the differences between cohorts, case controls, and random control trials. These are the three types of controls we're going to be discussing. We're going to discuss the definitions, the flow of time, and the hierarchy of different scientific evidence. The highest is systematic reviews, followed by randomized control trials, cohort studies, and case control studies. A case control is an observational study taking two different groups, differing in outcomes, and identifying and comparing causal attributes between them. Cohort studies are particular forms of studies that perform cross-sectional analysis through time, and a random control trial is one in which the participants are divided randomly into separate groups and compared based on the outcomes. This is a visual summary of the outcome to exposure flow for these different trials. This slide shows a couple of the differences between case controls and cohorts, covering when the outcome is observed, different number variations, and which ones are expensive versus inexpensive. Next, we're going to move on to cohort studies.
So, as it was said before, cohort studies are following from an exposure to seeing what happens after a certain amount of time to see the outcome. So the groups themselves are selected based on exposures. In this example, they're looking at amalgam restorations being the exposure, and if it leads to the outcome of Parkinson's disease. This is a retrospective study because it was completed in 2010, but they looked at the exposure of amalgams in 2001 to the outcome of Parkinson's in 2010. This was separated into two groups, those in the population of Taiwan that did not have amalgams in their dentition, and those that do have amalgams in their dentition. Everyone in Taiwan was used as in their retrospective study, and then in 2010, the outcome of Parkinson's was observed. At the end, from the exposure of amalgams, they did decide and find that those that were exposed to amalgams were 1.583 times more likely to develop the outcome of Parkinson's disease.
For case control, a case control selects samples based on the outcome being investigated and then looks back in time to see what exposures may have led to that outcome. For this reason, unlike a cohort study, the case controls must be retrospective and require the outcome exposure relationship to have already happened, otherwise the outcome would not be present to select for. An example of this comes from a design of an article researching the correlation of dental amalgam and restless leg syndrome. So the participants were selected based on the diagnosis of restless leg syndrome using a questionnaire, and were then looking back in time to see whether or not the patients were exposed to dental amalgams. This is just a visual representation of that.
So for random controlled trials, this is when a medical researcher will take a group of participants and randomly divide them into separate groups and expose them to the exposure in which they desire to compare the outcomes of. So an example of this would be they have a group of 600 participants and randomly assign the participants into two groups of 300, and then give the first group, Group A, the trial drug that they would like to see the effects of, and give the second group, Group B, a placebo sugar pill. They would then compare the outcomes for both groups to the control group, the Group B sugar pill group. And these are our references. Thank you very much.